Hey guys, Ivo and Scott here. Today we're going to talk all about the heel box and heel cups. Hey guys, Gate Geeks here, talking a little bit about ortho stuff. Today we're going to talk about the heel box, the area where the heel is supposed to fit on an orthotic and how important that is. So we understand mechanically, right? When somebody is walking, what's normally supposed to happen is we have initial contact, then loading response. As loading response happens, the calcaneus is supposed to evert 4 to 6 degrees, right? And as it everts 4 to 6 degrees, then the talar dome slides anteriorly, it plantar flexes, adducts, and everts, and that's what initiates pronation along with internal rotation of the tibia on that side. So the importance of the heel box during that motion is that when the calcaneus is everting, it needs something to evert against. How many times have you looked inside a shoe, right? And you see the outside part of the shoe where the heel is kind of worn away, right? Now, I'm not
The
talking
inside,
about
the inside part of the heel, right?
the inside of the heel, but I meant, yeah, inside the shoe, but the outside
Right,
of the
right,
heel, right? Yeah,
right.
yeah, in that area there. Now, I'm not talking
Aberrant.
about scuff on the skirt of the shoe, the little
Mhm.
cushioning part, but in that area there. So if you don't have anything to butt up against, what's going to happen to the calcaneus? It just keeps going west until it finds something to butt up against, or if it doesn't have anything to butt up against, the arch just collapses more and more and more, and the orthotic is kind of worthless. So,
And sometimes it actually shoots into E. The calcaneus goes into eversion. The rim isn't high enough, for lack of a better way to describe it. The rim's not high enough. The heel goes over the top of it a little bit and actually creates a friction point and causes some pain in that area too on the lateral aspect of the heel I've seen. So that's a problem I have personally, and I noticed when my orthotics are not adequately deep with regards to the amount of um, support on the medial lateral side, I find my heel pops over the side and actually becomes very uncomfortable over time.
yeah, you can even get blistering, callousing,
Correct.
that kind of stuff. I don't have anything. So here with these two, you can definitely see that this one is not as deep as this one, just as
Here's one
far as
that's
depths
pretty. This
go.
one's pretty shallow here that I have. If you contrast it with this one, you can see there's a little bit of a difference. You can appreciate it more if you kind of tilt it a little bit. But this one here, it's got nothing to really support it. So yeah, there's some fabric there, but the actual support of the actual heel is extremely minimal. So I can actually take this orthotic, and you can see I can literally fold it, so it's not offering really any support there at all.
Right. So rather than pay money for an orthotic, you could just use a pizza box in that particular case because it's really not doing much. There are
Right.
companies out there who shall remain nameless for the purpose of our podcast, but that build stuff like that all the time that has no heel cut
Zero.
whatsoever.
Flat.
And I'm
Flat.
like, okay, so how does this work? And oh, well, you're getting all this support here. It's like, right. But if you understand anything about mechanics of how the foot works, it's really not doing its job. So
Correct.
um, they're generally classified as, shallow, medium, and deep. And then beyond that, we have what's called a modified UCB, which is a super deep heel
Mhm.
cup that can have either a medial or lateral flange. You use that for people with severe pronatory disorders or severe rear foot valgus, that kind of stuff. The important thing, too, is also how much motion do you have in the calcaneus? When you pick the foot up and you're supporting it, can you rock it back and forth? Does it have a little bit of motion? If it's rigid, and you say somebody with a rigid rear foot valgus, which we do see, right?
Mhm.
And stage Achilles tendinopathies and things like that. Like you stick them in something with a deep heel cup, you're going to hurt those folks too.
Correct.
They're not going to do really, really well. And then that heel cup needs to blend as it comes forward into this
Mhm.
area here, which is the little shelf for the substentaculum tali. Okay. And if we're not supporting underneath that, we can't really control the rear foot. If we can't control the rear foot, we really can't control what's going on with the foot, at least in my opinion,
Mhm.
as far as what's going on. I'm not a big forefoot kind of guy. And
Hmm.
by the same token, if you control the rear foot too much and you don't have enough flexibility in the forefoot, you can create a problem as well. So the heel cup could be adequate, but if somebody has a rigid forefoot varus, that's where the forefoot is inverted with respect to the rear foot. As they come through mid stance into terminal stance and pre swing, that front edge of the foot is going to flop down onto the ground, and that heel is going to go laterally on that side. In that particular case, you might want to use some kind of a forefoot post. Not that the heel box isn't important in
Hmm.
somebody like that, but it's definitely um, you got to pay attention to the whole foot. It's not
Yeah,
just about that.
what I would add is I agree with you. If you don't control the rear foot, you don't have a fighting chance, right? But there are occasions where you need to control for both. And again, you got to start at the rear foot because as the foot hits the ground, it's the rear foot that really starts the initiation of the unloading and loading of the rest of the lower extremity, right? So if you don't control for that, then the rest of the chain is kind of it's almost irrelevant at that point, right? But if you get a good control of the rear foot, now you have a fighting chance to truly evaluate what's happening distally and address it if you need to, and if you don't need to, don't. But again, you've got to start where the foot hits the ground, which is the back.
And making sure, and Scott brought this up with the other orthotic, that you have some rigidity here. I shouldn't be able to fold this thing over. If you can go right over it. So this is an acrylic orthotic. This one here is made out of 75 durometer EVA, and it has some give to it, but it's not a pushover as far as that. Now, this is definitely a shallower, I don't know if you can really see that, shallower heel box than what we're looking at. But as the heel comes over, you have to have enough laterally for it to press on to kind of
Mhm.
catch that. Whereas what Scott had, if you can show that again, Scott, there's
Sure.
just nothing there. And you might as well just have it flat. And like I said, you can just go buy a pizza box, eat the pizza, and then cut the box into the shape of the sole and stick it in your shoe because it's going to do about the same amount of help
Yeah,
as something like that. So
exactly.
other things that you can think about, Scott, other things that you do with the heel box of a shoe or the heel box of an orthotic. Like, do you ever put sweet spots in them or anything like that for people that have calcaneal spurs or stuff like that?
Absolutely. Almost like horseshoe pads that I will
Yeah.
actually build. I'll actually build it into the shoe itself, whether I use a felt pad that's got an adhesive back on one side to kind of
So
offload a
talk about
certain
what that
area.
actually is, Scott, in case people don't know.
So basically what I would do is I'm going to take my shoe off here. What I would sometimes do here, let me see if the best way to look at this. I may put, let's say somebody's got a really tender insertion point of the Achilles tendon into the calcaneus, and there's one real spot that's really localized that's sore. And every time they kind of walk and that heel kind of rubs against it, it becomes problematic and painful. Oftentimes, what I'll do is I'll take a piece of felt that's got some adhesive on one side, and I'll actually create a horseshoe. And what a horseshoe is basically a prominence in the area around that painful area while offloading or creating a hole or a void in the material right where that painful spot is. So the pressure goes onto the felt pad into the tissue that's non-tender, offloading the tender spot.
So you're basically creating a hole.
You're basically creating a hole, exactly. Or it doesn't necessarily have to be a hole. It could be the shape of the offload could vary.
Right.
Could be more horseshoe shaped. It could be teardrop shaped. It can be a circular kind of hole as well. It all depends on the size, what kind of material you're dealing with, how much room you have to build what you want to build. So all of that works really, really good to kind of offload, whether it be a bursa too. A retrocalcaneal bursitis is another example of where I might do something like that, where the shoe itself is just pretty uncomfortable and you got to figure out a way to kind of offload that tissue, and a horseshoe or a padding around it helps tremendously.
Right, and you can use cotton material.
Sure.
We use Poron a lot of times or
Sure.
Plastizote when we're doing that. And a lot of times, in addition to what Scott's doing, adhering it on there, we oftentimes will put a piece of duct tape over the top of it. And basically, because duct tape is largely anti slip. We can use it for blisters and stuff like that. So as a result, I shouldn't say anti-slip. It allows, motion
Hmm.
to occur over that anti-stick. So it allows the skin to move smoothly over it so you don't develop a
Hmm.
blister or something like that. A lot of times we'll take an orthotic like this, we'll hollow out. I'm trying to get it in focus here. I can't. There we go. We'll hollow out in the actual shell of the orthotic down here, and then we take a met pad, turn it upside down so the flat side is up, and we'll sit that right in the hole, or we'll fill it with Poron, and then we put our top cover over, which creates a nice
Soft spot.
soft area. We call them sweets or sweet spots
Hmm.
down in there. Do that a lot of times when people, you take an X-ray, they definitely have soreness over that big spur on the bottom of the calcaneus from the plantar fascia. A lot of those are asymptomatic, but some people do have really symptomatic ones, or more often than not, what we see is people have fractured those, and
Yeah.
the plantar fascia is literally torn it off there, and that's super sore. So unloading that spot can make a huge difference.
And another thing to think about is, Ivo just brought up a great point, in terms of the heel and tenderness, whether you've got a spur, when we start talking about, plantar fasciopathy versus heel pad atrophy. I think heel pad atrophy is one of those things that oftentimes gets missed or misdiagnosed as plantar fasciopathy. And, as people get older or they're taking certain medications, we start to see that that fat pad doesn't offer the protection to the calcaneus as it once did. Therefore, I think those gel heel pads do a wonderful job of creating an artificial fat pad to further cushion. So when people come in and they have plantar fasciitis, true plantar fasciitis, and they have a gel heel pad, I don't think they're necessarily treating the problem the correct way. Whereas if they do have, in fact, a plantar fat pad atrophy syndrome, then I think that gel heel pad is really appropriate for those. So just because you have heel pain doesn't mean a gel pad is going to work, and just because you have plantar fasciopathy doesn't necessarily mean it won't. But I think there's a time and a place for each of those, depending on the root cause of what's causing that pain and where the pain is.
So putting a pad in, according to
Hmm.
some of the studies that I've read, there was one I read earlier today. It's what is it out of? It's out of Journal of Clinical Medicine 22, April 12th. Biomechanical effects of plastic heel cup on plantar fasciitis patients,
Uh-huh.
evaluated by ultrasound shear wave elastography. Um, Bottom line is padding like that or a cup. This was looking at the like Thule heel cups that you can actually stick inside a
Sure.
shoe, does basically it cuts shear forces by 50%. And we know from blisters, you guys have probably listened to our blister lecture before, cutting down shear makes a huge difference. So it cuts shear by 50% and it increases the thickness of the person's fat pad by approximately 30%, about a third. Okay, so it's 37 in some cases, depending upon. So just by taking the heel, squishing it in, and offering them some support underneath, that takes the existing fat pad, which is atrophied a lot of times. And you should be palpating this on your patients, feeling that. How can you tell if it's atrophied? Start palpating everybody's tomorrow, at your
Hmm.
clinic. And I guarantee there's going to be people, particularly in the older population, or people that have been on steroids for a long period of time, that
Correct.
kind of stuff, that are just not going to have as much fat pad there. And you're going to feel, it's like, ooh, I can kind of feel the bone through there. So
Uh-huh.
another way, if you can't fit a heel cup or a gel pad into there, is if you make their heel box narrower, you're going to create a little bit of float for that person, resulting in one, more cushioning, and two, less shear.
I do that all the time, and I use tape. I,
Yep.
I basically do a tape job. You do it. You can use different types of tape. I usually just use it with white athletic tape, and I create the fat pad. And exactly like I was talking about, you're basically bringing the lateral border and the medial border of the fat pads that do exist, and you're basically pushing it to the plantar surface so that it actually creates more of that distance between the bone and actually the interface of the ground. It's wonderful. Works great. People love it.
Yeah, it's super awesome. So when you're seeing people that have fat pad atrophy, one of the things you should be thinking about or looking at least we think, is it symmetrical and do they have it on both sides? And if not, why? Like, what is driving that anatomically? Do they have an injury? Do they have a longer leg on one side? Do they have some anatomical abnormality that wore it away? What exactly happened to it on that side, so that we can address that. If a person has a leg length discrepancy, generally speaking, the longer leg side hits harder, pronates more, there's greater amounts of shear force, all of those things. So putting a small lift in the opposite side, okay, or if you can't fit a lift into the shoe, remove the sock liner of the affected side. As counterintuitive as that sounds, you're essentially lifting the opposite side by leaving the sock liner in, usually 2 to 3 mils. That can make a game changer amount of difference for folks and their comfort levels when they're when they're running a race or something like that. They're coming in and they're having all this focal heel pain. Sometimes people get stone bruises or periosteal bruises, because they were, walking on the beach and they hit a pebble or something like that, or they stepped on some coral while they were diving, or, whatever. Making that more comfortable in that respect makes a huge, huge difference.
Yeah.
And the tape is just brilliant, as far as being able to bring that in from the sides. You can modify the inside of the shoe as well. If you can't get tape around the back of their foot for whatever reason, or that's not staying on, as Scott was talking about, you can take some sort of a cotton batting material. We use EVA. We have different durometer densities and sizes and thicknesses in the office. So we might put out, like take some 5 mil EVA, or even sometimes 10 mil or whatever, skive that out and glue that right into the back of the shoe to create a little tighter heel pocket for that foot to help float that calcaneus up above just a little bit.
Yeah, I think all of those are options for clinicians to try and to see what works best. And there are certain shoes that where I work with athletes, and there are certain athletes that don't have them like in their spikes. A classic example is a triple jumper that lands pretty hard, and sticking an orthotic into the shoe isn't always appropriate. So if I can get some tape on their skin pretty tight, but yet at the same time make a little bit more of a prominent area to protect a sore spot, I've had pretty good results with that as well.
Yeah. Yeah. So, hey, maybe some of you guys out there have different tricks for this, and different ideas about how to make this better. And if so, drop us a line. You know, Check us out at the website. You can find us on YouTube. You can find us on Instagram, but drop us a line, drop us an email, and let's talk about it.
Yeah, always willing to help any way we can. Appreciate you guys for listening. Till we see you again.
Take care.